Beach and Pacific Grove. I'm delighted you could be here. I'd like to take a few minutes during this segment to talk about easy ways, simple ways, quick, fast ways that most people can improve their appearance. That's quite a challenge I've given myself, but I think we can really answer that question if we were to say, what are some of the easy ways that people can improve their appearance? I think we have some tools in our toolkit, in our armamentarium, that we can actually use that are effective. First of all, let's return to this phrase you've heard me use many times. That's the triangle of beauty, the triangle of facial reconstruction. Three parts to the triangle. The triangle sits on a foundation. Number one is the skin. And I think it's very important for all people who live in California or who have enjoyed the outdoor life wherever you live to take good care of your skin. We can improve the health and appearance of your skin with some straightforward, pretty easy programs that most of you can do at home. A lot like having good dental care. You'll see the dental hygienist, you'll see the dentist 2 or 3 times a year. And then at home you do your brushing and flossing or water picking, etc. So the first part of the triangle is the skin. The second part of the triangle is volume. That's the second corner. As you know, you've heard me say this, as we mature we tend to lose fat in our face and in our hands, and we put that fat on in the trunk. It's an unfunny practical joke. So we can talk about different ways to revolumize the face and make up for that lost fat. Now, the third component, or the third corner of the triangle, that's the soft tissue position and amount. And there are things that we can do, typically surgical. Now, those aren't so straightforward and are not so easy that we're not going to call those lunchtime treatments. But I am going to talk about mini lifts and smaller operations that can provide dramatic improvement in someone's appearance. So, once again, the triangle of beauty, or the triangle of facial rejuvenation, the skin, then there's volume, then there's the soft tissue position and amount. Now, that triangle rests upon a foundation, and that's the cranial facial skeleton, the jaw, the cheekbones. Some people would include the forehead and the nose and the ears. So not everyone needs their craniofacial skeleton or the foundation to be addressed, but we always want to include that in our facial analysis. So let's go back to the skin, that first part of the triangle. Everyone, I believe, should be taking good care of their skin the same way that you do your personal hygiene, the same way that you take care of your teeth. For example, as you heard me talk a few minutes prior about seeing the dental hygienist or seeing the dentist 2 or 3 times a year for cleaning and maybe x-rays and dental analysis, etc. And at home, you do your own flossing and brushing and dental oral pharyngeal care. I think that's important. There are a few basics to good skin care that I think everyone should be familiar with. First of all, avoid the sun. I know that's hard for a lot of people because many of us live in outdoor areas such as California and Oregon and Washington, especially in Southern California, where we love to be outdoors. Well, the sun actually is not our friend, although it feels great. Those UV rays can damage the collagen, damage the cells, damage the DNA, can lead to more skin cancer, and can actually lead to something called solar elastosis, where the collagen layer is disrupted and gets very thin and disorderly. People get so-called liver spots and pigment changes and age spots. So what do we do for people when they come in? First of all, a skin analysis I think is very important. Teaching people to avoid the sun, and also avoiding smoking and avoiding secondhand smoke. You're all familiar with antioxidants, probably such as blueberries and certain super rich foods and superfoods that can help you to ingest antioxidants. Well, cigarette smoke does the opposite. It's like an oxidant that helps rust the microvascular little tiny vessels, can be damaged by the cigarette smoke, and that plays havoc with your internal organs such as the lungs and liver and kidney, etc. And it can also play havoc with the skin. Now, avoiding the sun, avoiding direct sun, avoiding smoke, cigarette smoke. Now, everyone should learn to properly cleanse their skin. Some people have dry skin, some people have oily skin, some people have patches. A plastic surgeon or dermatologist or esthetician can teach you how to properly cleanse. Next is exfoliation. The very top layer of the skin has the keratin layer. That's not living. It's very similar to nails and hair. When that keratin layer gets too thick, the skin loses its sheen. It can lose its brightness. And so oftentimes exfoliating, thinning out that keratin layer and get the very top cells to exfoliate, to come off, will actually do some stimulation to the baby cells and to turn on the factory. Now, that leads me to our next part of good skincare, and that's regeneration. We want to encourage the baby cells to have that factory, the germinal matrix, to get turned on and come to the surface. So the cells are actually turning over every day. Please keep in mind that it takes at least 30 days for a baby cell to get from the germinal matrix up to the top of the skin where it can be noticed. So sometimes I hear people say, you know, Dr. Morwood, I did skincare for a couple weeks and I don't notice any difference. You really need to give your cells in the skin an opportunity to turn over and get to the top where you notice it. And we can actually improve not only the appearance but the health of your skin by encouraging more regeneration and getting that germinal matrix and the baby cell factory to turn on. Now, what else can we do? Everyone needs to properly moisturize your skin and use sunblocks. So we can oftentimes give you products, skincare products that have a combination moisturizer and sunblock. Sometimes they're separate. But as we do proper skincare and we're exfoliating and learning to properly cleanse, we need to replace that moisture barrier. We don't want you to get dried out skin or get exposed to the wind and the sun. So again, there are some simple components to skincare. I'm a big believer in facials and getting analyzed by an esthetician or plastic surgeon or dermatologist. There's something called a Fitzpatrick scale or Fitzpatrick-Glogau scale where the pigment in your skin will be categorized from 1 to 6. Number 1 are those people from very northern Scandinavia, very fair skin, blue eyes, blonde. They never tan, they get burned just by going out to the direct sun for a few minutes, all the way down on the grade of the scale to people who have genetic background, very black skin, very dark brown from the African continent, and most people are in the middle, 2 through 5, etc. So that helps us to predict, helps us to correlate and prescribe proper skin care for you. And again, I think all people living the California lifestyle should learn to properly take care of your skin. Now, number 2, what about the volume? I said as we mature, we lose fat in our hands, we lose fat in our face, and we put that fat on, we put that volume on in the trunk. It's an unfunny practical joke. What about revolumization? Most people know the term high cheekbones for the models, whether you're a man or a woman, to have a well-defined face that projects and that is full. That's really important for the attractive face. I will sometimes hear in the office people come in, especially a woman will come in and say that I feel in the past 2 or 3 years I've turned from a plum into a prune, or I've turned from a grape into a raisin. What they're really doing is telling me that they've lost volume in the face. And so the old style, perhaps, or more traditional or older way we would do facial rejuvenation is remove skin, really pull hard, pull and then cut the extra skin off and sew up before it has a chance to spring back. Well, that tends to give people a very flattened appearance. It tends to give people a very dull, sort of flattened appearance without much projection. I'm a big believer in lifting and filling. Let's say we can take that prune and instead of just stretching the skin to try to get it to look more like a plum, how about if we revolumize? How about if we take that raisin that's shriveled up from a grape and revolumize it as opposed to stretching the skin and clipping off the skin or taking the skin off. So how are some of the ways we do that? There are 2 straightforward ways. One is with the use of fillers, and I'm big on fillers when properly used for the right indication, to give us higher cheekbones, to restore mid-face volume loss, to increase the volume in the nasolabial folds, in the piriform aperture, possibly to bring the chin forward, to accent the mandibular angles. On occasion, I do use fillers to minimize a wrinkle or ridged or crease, but that's not my favorite reason to use a filler. I like fillers to revolumize, especially the deeper tissues. The tear troughs, that's the eyelid-cheek junction, particularly at the medial part of the eyelid. When I say medial, closer to the nose as opposed to the lateral, closer to the ear. So we can oftentimes smooth out that eyelid-cheek junction. You've heard me talk about if we have a mountain and a valley and a hill, something that we can do is to take the hill and mountain down, or what we can do is fill up the valley to make them all smoother. We would like a smooth eyelid-cheek junction. So fillers can be very effective. It's a lunchtime treatment. You can come in and I can give you a variation of a dental block, and we can take the syringe. It comes in a sterile box, and it's a lunchtime treatment. The other way we revolumize is with the use of a person's own fat. Fat grafting is that process whereby we do some conservative amount of liposuction with a syringe manually, and I harvest that fat. Then we can decant it, spin it down. Sometimes we centrifuge it, we keep it sterile. I do something called a closed sterile fill system, where then we take that fat and we can re-inject it into where there's missing fat, the cheekbones, the midface, the nasolabial folds, the piriform area, piriform sinuses, sometimes the chin, the mandibular angles. In Hollywood now, it's a very in vogue, it's a very popular look now to have prominent mandibular angles for both women and for men. The temporal hollowing can be corrected. And also, we can re-inject that fat into the hands. We can help hide the veins, we can help fill those sort of grooves in between the tendons. So revolumizing with fillers or with fat grafting can be very effective. And those things can be done right in the office. Now, what about the third component to the facial rejuvenation triangle, and that is the soft tissue position and amount. Typically we look for incisions and surgical procedures for that, but by no means do people who come into my office, not all of them get a recommendation for a big neck lift, the natural neck lift, or a facelift, or big complicated operations. Certainly we do those, but more and more now we're prescribing very targeted procedures. We're making smaller incisions. We're doing more through smaller incisions. I'm using fiber optic lighting and loop magnification, magnifying lenses that I wear so I can operate on the deeper tissues through very small, much smaller incisions. And we can do mini lifts. We can do eyelids in the office, uppers and lowers. We can do lateral brow elevations. I mentioned mini facelifts. We can do mini neck lifts. We can do liposuction of the face in the office. So those are all what I consider to be pretty straightforward, more simple, less complex ways that people can improve their appearance. Now, I mentioned that the triangle of facial rejuvenation rests upon the foundation. Almost always when we talk about restoration or improvement of the craniofacial skeleton, that's a little more invasive. I don't consider that to be simple or easy ways. If we're going to do bony movement of the chin or the jaw, if we're going to affect the nose or even the ears or the forehead, etc., that tends to need an anesthetic in an operating room, but certainly they can be very powerful and very effective. If you would like any more information on what I call straightforward, more simple ways to improve your appearance, I hope you'll go to my website, drmorwood.com. That's DRMORWOOD. I'm right here in Monterey, 831-646-8661. Once again, I'm Dr. David Morwood. I'm a board-certified plastic surgeon here in beautiful Monterey, California. We're going to take a very brief pause.